Birth control and cervical cancer risk. What you need to know: cervical cancer is a common type of cancer in women. While numerous factors can contribute to the risk, the use of birth control and immune health are often discussed concerns. Birth control use. While some studies have suggested a potential link between long-term over 5 years birth control use and cervical cancer risk, there is currently no definitive scientific evidence to confirm a causal relationship between these two factors. Birth control use. The studies often focused on older generation birth control pills, which contained higher levels of estrogen. With modern birth control pills, the estrogen content is lower, and they often include progestin, which has significantly reduced potential side effects, including the risk of cervical cancer. Birth control use. However, birth control use can impact the immune system and potentially increase the risk of HPV infection, a primary cause of cervical cancer. Weakened immune system. A strong immune system plays a crucial role in fighting off viruses, including HPV. A weakened immune system makes it harder for the body to eliminate HPV, increasing the risk of persistent infection and the development of cervical cancer. Weakened immune system. Those with weakened immune systems, including people living with HIV or those taking immunosuppressant medication, should be particularly vigilant about regular checkups and HPV vaccination. HPV infection. Most cervical cancer cases are caused by persistent HPV infection. Birth control use doesn't directly cause HPV infection but can increase the risk of HPV infection by altering the vaginal microbiome, creating conditions conducive to HPV entry. To minimize the risk of cervical cancer, women should practice HPV prevention methods, such as using condoms during sexual activity. Get the HPV vaccine to prevent infection with HPV strains that cause cervical cancer. Schedule regular gynecological checkups to detect any abnormalities early and receive timely treatment. To minimize the risk of cervical cancer, women should maintain a healthy lifestyle, including a balanced diet, regular exercise, avoiding smoking, and limiting alcohol consumption. Note: this information is intended for general knowledge and does not substitute for professional medical advice. Consult a doctor for personalized advice and treatment.